Hello all. I want to speak with you today about several very serious issues that we are facing in Maine. These issues are disturbing, but to be frank, the way they are being managed borders on being reprehensible. When Columbus started out, he didn't know where he was going. When he got there, he didn't know where he was. When he got back home, he didn't know where he had been. I'm beginning to think that Columbus and Maine's Department of Health and Human Services were passengers on the same ship. Maine's public health system is the one entity that is responsible for promotion of the science of protecting and improving the health of families and communities across our state. From healthy lifestyles to research for disease and injury prevention, and detection and control of infectious diseases. The populations included in this endeavor can be as small as a local neighborhood or as big as the largest county in the state. Currently, Maine is in the midst of a public health crisis like none before. That crisis is decimating our towns and communities from this ongoing opioid crisis. Due to the self-imposed restructuring of the Department of Health and Human Services by Governor LePage and Commissioner Mary Mayhew, I, for one, am very skeptical of this administration's ability and commitment to resolving not only this problem, but the problems of young mothers and children, mentally disabled citizens, and the needs of our seniors. Our public health system spans across all of these areas. Maine's public health system and its infrastructure are currently in complete disarray, drifting at sea on a rudderless course. First, Governor LePage has refused to fill public health nurse slots by imposing a freeze on the hiring of public health nurses, despite the fact that at least 30% of these positions are funded through maternal and child health block grants and not through the Maine state budget. The governor's fiat has left the state with less than 25 public health nurses to cover public health issues across the entire state. These remaining nurses have no support staff to effectively do their jobs, and many are working out of their cars. This freeze is a 50% reduction in the number of public health nurses from 2009 during the H1N1 influenza outbreak in Maine. The next catastrophe came with the administration's decision to consolidate the functions of the Maine Center for Disease Control and Prevention, whereby this agency is now operating without a director and will do so for the remainder of Governor LePage's tenure. The Chief Operating Officer of the Maine CDC is now reporting directly to Commissioner Mayhew. The LePage administration has also unilaterally decided to, quote, rework, end quote, the state's way of how it manages substance abuse, tobacco, and chronic disease prevention by ending the services of the 27 Healthy Maine partnerships that have been serving the people of Maine for more than 10 years. These services will now be outsourced to private vendors and will no longer be coordinated in a regional manner. The governor's new system will rely on 5 organizations that will have statewide responsibility for coordinating a specific public health function. For example, one for substance use prevention, one for tobacco use and exposure, one for obesity prevention, one for youth engagement and empowerment, and one for health communications. Now, how do you suppose this new system is going to work out? Next, we learn that Commissioner Mayhew has been illegally playing a shell game with federal funds intended for low-income families and children. The Department of Health and Human Services has misspent $13.4 million in federal welfare money earmarked for these families, willfully knowing that this was a fraudulent endeavor. The department transferred $7.8 million in 2015 and another $5.6 million of temporary assistance for needy families monies to the Social Security Block Grant for services for the elderly and disabled. So the question is, what exactly is the administration's intent? And when it comes to providing assistance to low-income families with children, the disabled, and our elderly population, all of whom are in positions where they need help and assistance from their state government. What happens to these people? What value are we placing on the lives of those less fortunate than the rest of us? Apparently, playing a shell game is the answer. And now, our latest event is our state is facing the most challenging public health crisis in decades. The National Center for Disease Control and Prevention has placed opioid abuse and addiction on its top 5 list of the greatest public health challenges we face as a nation. This problem has created a public health concern of massive proportions. In 2014, 47,000 people died from overdoses. Not only is this number higher than deaths caused by vehicle accidents, it is the largest number of overdose deaths ever recorded in U.S. history. The overdose death rate in Maine increased 31% from 2014 to 2015. Additionally, 1 out of every 11 babies born in 2015 were drug affected. In 2015, 272 Maine citizens lost their lives to opioid heroin deaths. We can no longer say that this problem is not in our backyard. It is now in the homes of many Maine families. In May of 2016, the Maine Opiate Collaborative released its report which addressed the opioid heroin epidemic in Maine. The time, efforts, and ensuing recommendations of the work done by this volunteer group is commendable. The group clearly recognizes the problems that we are facing in Maine and offered sensible recommendations towards a beginning for combating this problem. Of particular interest were the goals of promoting good public health and safety and reducing the harmful effects of opiate use, strengthening and enhancing Maine's public health infrastructure to prevent and reduce opiate use disorders and overdose deaths, and expanding access to evidence-based treatment for opioid dependence. Now, given the multitude and the magnitude of all of the public health problems our state is facing, it is irresponsible for Governor LePage and Commissioner Mayhew to continue down this path of willful destruction of Maine's public health infrastructure. Addiction is a chronic disease, like diabetes or heart disease, meaning there is no cure. But addiction can be managed, and people with addiction can and do recover. Maine's treatment options for this addiction are sparse. In 2015, those options decreased further because of the closure of 2 treatment centers in Maine, Mercy Recovery Center in Westbrook and Spectrum Health Systems in Sanford. It comes as no surprise that addicts are much more likely to lack insurance than the general public. Medicaid expansion, to which Governor LePage is ideologically opposed, would substantially increase access for substance abuse treatment across this state. Public health connects us all. We are at a point where Maine should be investing in its public health system, not dismantling it. The LePage administration must realize that we are facing a very large community problem, one that cannot be resolved by any one group alone. At some point, one has to stand for something. More is expected of our elected officials than a wink, a nod, and a handshake. We are dealing with people's lives. It is time for our state government leaders to take a more serious and less ideological approach towards doing what they know is right for and in the best interest of all Maine citizens. Until next time, I thank you for your attention.